15-year-old Josh represented his state in gymnastics.
Yes, Josh!
I love it so much. It's basically taken up my whole life. Like, I'll go to training 14 hours a week, spread across 4 days.
But he now finds himself in a very different gym.
Hello, come in.
2 bad falls during training landed him here.
Okay, do you want to pop that one on your head, Josh?
Concussion never crossed my mind. I just thought, I have just got a sore neck. Like, I just got up and kept going.
Do you want to close your eyes?
In the days and weeks after his second injury, his symptoms got worse.
And then bring yourself back to the middle. Tell me when you...
Josh struggles with concentration, dizziness, headaches and nausea. This exercise is helping repair his spatial awareness.
That's so challenging.
It is hard, isn't it? You're doing a really good job though.
You always want to do the best for your kids, and it's really hard when you don't know what that is, when you've never been through anything like this.
How do you think things are going?
It took months for Josh to get a correct diagnosis and a referral to a specialist rehabilitation clinic in Melbourne.
It was really difficult to find someone who would see a 15-year-old with this type of injury.
The majority of this clinic's patients are adults, but it does see some teenagers.
We are struggling a bit to keep up with the demands. There is a wait list. Medically, we're trying to keep it down to 2 to 4 weeks.
Staff here are helping set up similar clinics in other states, but there's also a call for specialised child clinics. That's because children can take longer to recover and many aren't being properly treated. Most kids will be symptom-free 10 days after a concussion, but for the others, like Josh, it can be a longer road to recovery.
We really don't worry too much about one concussion. We worry more when there's multiple concussions that are happening.
The majority of concussions in children actually happen in general play rather than in sport. But the risk of repeated injuries is greater on the sporting field.
The really important message is to get parents and coaches to make sure that kids are fully better before they go back to sport.
Correct. So I say, Will, I'm coming to you.
These young players are being put through their paces on and off the field.
Okay, Luke, so just place
this eye scanning machine helps to check for concussion.
And I want you to follow the dot on the screen with your eyes. We're able to have a baseline test that's pre-injury, so we know what their brain is doing prior to an injury. And then we can then obviously screen them again after their injury and compare those two tests together.
16-year-old Luke Eastwood has just returned after a month off following a concussion.
Missed a fair few weeks of footy, missed weeks of school, came back through half days, and how it helped having the eye guide to know where I was at and how I was recovering.
The technology isn't foolproof. Symptoms can vary, so other standard concussion tests are still needed. A paramedic is also being paid to be on the sidelines of games.
The club believes being proactive about concussion is vital to keep children playing the game. Other teams in the league have been asking about the systems being used here.
I feel like we've had to kind of, branch out on our own and try to use whatever tools we can to try to get, to let parents know that their children are safe if they come and play footy.
For me as a club administrator, I'm really proud of my club to do this. But for me personally as a mother, just to know that safety net is there for my child and everyone else's child that plays here is worth every cent. Yeah.
The club has found dangerous sling tackles caused a majority of its concussions, an issue it says has improved since it raised it with local umpires. There's ongoing debate about modifying rules for junior leagues, especially when it comes to tackling. In the United States, there's a push to stop tackling in junior grades of gridiron.
Tackle football is like smoking. The younger I start, the longer I'm exposed to danger.
I do think that it's important that at least some of those skills are built in a safe way and that we don't wrap kids in cotton wool.
Josh still isn't at school full-time and he doesn't know if or when he'll return to the sport he loves. But he is glad to be seeing small improvements.
I'm definitely feeling a lot more encouraged and hopeful. I can see the light at the end of the tunnel now.
Natalie Whiting, ABC News.